first I'm doing my room scan. My water bottle is just to hold up my iPad. Here is my setup. Making sure you can see me. I have my math here. Literally just my math. My drug book. And my supplies. Here is my med, 1 ml. Prepped and ready to. Alright. Hi, my name is Danielle. I'm going to be your student nurse today. Can I get your first and last name? And your date of birth? Are you allergic to anything? Perfect. I've performed hand hygiene and I'm going to provide privacy. So, looking at providers' orders, I'm going to be giving you an IV push dose of digoxin. I have 1 milliliter of digoxin, and I'm going to be giving that over 5 minutes, so 0.2 milliliters per minute. So, just about digoxin, you're taking it for congestive heart failure, and it is a safe dose as it is what is prescribed. I'm going to make sure I monitor for signs and symptoms of digoxin toxicity, so looking at your labs and making sure your apical pulse is not below 60 or below. And this is compatible with normal saline, and this inhibits the sodium-potassium pump that is responsible for moving sodium and potassium in and out of the cells to increase the force and velocity of your heart contraction. And I'm going to monitor your electrolytes, your digitoxicity, and your heart rate and blood pressure, and look at your ECG for cardiac arrhythmias. So just make sure you report any nausea, vomiting, diarrhea, confusion, weakness, or any visual disturbances, as those are signs of toxicity. You might have some abdominal pain, dizziness, headache, weakness, rash, or visual changes, and we will be monitoring you for that. So I have my med ready. I'm going to put my gloves on. And before I do anything, I am going to inspect the IV site, making sure that there's no inflammation, redness, swelling. I'm checking underneath to make sure there's no leakage of the IV site underneath the arm, and it is labeled appropriately and such. So first, what I'm going to do is I'm going to get my normal saline and my med ready. I'm going to take my alcohol swab, and I'm going to scrub for 30 seconds. "30 seconds have passed," not letting go of the sterile end of the J-loop. I'm going to attach my syringe. I'm going to drop back, checking for blood return. Unclamping my clamp on my J-loop, and I'm checking for blood return, and there is. So I'm going to use the push pause method to flush. And I'm going to do 3 to 5 mLs. Take that off. And I'm going to scrub my hub again for 30 seconds. Now that 30 seconds have passed, I'm going to grab my med. I'm going to take this cap off and attach, and ensuring that I give this over 5 minutes, so 0.2 ml for each minute. Alright, 5 minutes has passed. I'm going to take this off, grab my alcohol swab, and again, scrub for 30 seconds. Grab my other saline flush, checking again to make sure that it's not, that there's no air at the end. And I'm going to give 1 ml over 5 minutes, just like my digoxin. So I'm going to give 0.2 ml per minute. Five minutes has passed, so I'm going to give the remaining 2 ml of my flush using the push pause method, and I'm giving the remaining 2 mLs per provider's orders. Okay, take this off. I would put my sharps directly in my sharp spin. I'm just going to clean this up. Are you comfortable, Joe? Is there anything else I can get for you? Perfect. And I would monitor his ECG and for any reactions to that.